which is good.
Yeah.
Welcome back. Well, today we have a doctor from Harvard Eye who's been with us before, Dr. Karen Skarma. And doctor, we are talking about dry eyes.
Yes, we are.
Now, a lot of times people get dry eyes for various reasons.
Right.
Working in the yard, you're out maybe at the beach and the wind and the sand and all that. But what we're talking about is something a little bit more over than that, something that is more of a chronic condition, right?
Correct. Yeah, it's very common for people to occasionally have something where their eyes are dry or a little bit irritated, but there are some people who are dry all the time and really having trouble. So we like to get those people in and help them. There's a lot of things we can do to help them out, and there's some new things that we can do to help them out too. So.
And here are the reasons why people may have dry eyes, right?
Yeah, I mean, it's very common. Some people just don't produce adequate tears, and some people produce a very poor quality tear. Sometimes the anatomy of the eye is such that they just don't move the tears off the eye. So it's pretty common for some people to have trouble. Dry eye is a very common condition. About 1 in 7 people have dry eye. That's about 20 million people in the United States. So we're finding in Southern California, where we're a desert pretty much, and people who are living in this area, if they go up to the Bay Area, they oftentimes feel much better than when they're down here.
Okay.
Yeah. So people go to Hawaii, they feel great, but when they get back to Southern California, it's pretty tough. People who work on computers all the time or use their iPads or their Kindles, they're having trouble. People who are diabetics or people who have things like rheumatoid arthritis or Sjogren's, lupus, they also have trouble. So there's quite a few people who are having trouble. And again, there's some new things that we've got out that we can use to help them.
So a lot of reasons from environmental to also medical, right?
To medical. Women more common than men. People over 50 usually are a little bit more susceptible to dry eye. So there's a lot of different reasons.
So it's common, and can this start at an early age? Can even kids have dry eye?
Sure. It's actually interesting that we're seeing it more and more. And we think it's because of the digital device. People are on their iPhones, and when you stare at something, you tend to blink less. And
Interesting.
So starting to see it more and more.
Okay.
Yeah.
So we know that it's pretty common, and the symptoms are, people would think, okay, my symptoms is I got itchy eyes, which can certainly be a symptom. I think, we talked about who gets it and why. You got a little, as far as a little cartoon here that's funny. Can you relate? And it's very interesting that the symptoms can be mild, they can be strong, they can be every day. It's really about finding out if it is something that is more serious than just, as I said, we all get it now and then for some reason or another.
Right. First of all, dry eye is a little bit paradoxical in that oftentimes the people who have the fewest medical signs have the most symptoms.
Really?
And the people who have the least signs are medically usually more advanced.
Okay.
And that's usually because the nerves start to become less sensitive as they're more exposed. But oftentimes with dry eyes, we'll get the most interesting symptom, and people don't believe, is that people's eyes are wet. And usually that's because when your eyes are dry, you feel like you have a foreign body sensation, and we are designed to just wash that out with our tears, with the reflex secretion of tears. So the most common symptom of a dry eye is a wet eye.
Wow.
Oftentimes you get burning, gritty, sandy feeling. Oftentimes what will happen is that your vision is a little bit blurry, or you'll fluctuate. People will find they're reading for a while, and then after a while they just can't see, and then they blink and it'll clear up, and then it goes away. So that's one of the more common
So it's sometimes
signs.
wet eyes. That's interesting.
Yeah, it really is.
I mean, the other ones I would certainly understand.
Right. But most people come in and they kind of don't believe us at first. So,
yeah. So how can it be helped, and how can your doctor help you?
So really, the most important thing is just when you come in for an exam, be very specific, as specific as possible about when you're having trouble, what your symptoms are. It's really good to know what drops people are using so that we
Okay.
don't replicate the same drops, and also what people have tried in the past and what has worked and what hasn't worked. So it helps us know what's going on a little bit better.
Now, as far as examinations go, can you tell if somebody has a dry eye?
Yeah, certainly. So generally, the first thing we do is check vision. There are some tests that we can do. There's a lot of different ones. One of the most common older tests is called the Schirmer's test. It's not as reliable as some of the other newer tests, but it's kind of the old standard, so some people use that. There's some new tests called the osmolarity test, which really tests the stability of the tear film, and then there's something called the MMP9 test, which tests for inflammation, and those tests are very good for guiding our treatment protocol.
All right. Now, as far as treatment options, from drops to something more drastic, or it just depends?
Yeah, I actually have a handout that I give out that is one full page long, and they start from very, simple procedures such as artificial tears, warm compresses, lid scrubs, omega-3 fatty acids. When you have an examination, depending on the kind of dry eye, we will recommend those. Sleep goggles for people who don't close their eyes properly. Wraparound sunglasses sometimes are very helpful.
Okay.
So we have we go to gel tears and ointment, and there's sodium chloride. The most important thing really is to determine what kind of dry eye is it. There's a couple different things that are kind of major categories. So you have a category of inflammation, and when a person has an inflammatory dry eye, they create a poor quality of tear.
Okay.
And things like, I know people have heard of Restasis. So Restasis is one of the drops we use. There's a new medication now, it's very new, called Xiidra. We also sometimes will use things like steroid drops in that situation. If a person has a oil deficient dry eye, those medications aren't necessarily going to be helpful for them. And that's where we do things like warm compresses. We oftentimes have to do lid scrubs. There's a new treatment. So I brought this to show people. So this is something called BluffX, which actually you use along the lid margin. It's kind of like a dental hygiene. So you can turn it on and you just kind of go back and forth along the lid margin, and that actually removes the bacteria and the debris that's on the lid margin, and allows the oil to flow more. It can allow the oil to flow more freely out of capped meibomian glands.
Okay.
So that's another another treatment that we have. There's something called LipiFlow, which allows us to open up the eyelid margins and allow the oil just to get it to move more smoothly.
Okay, and you also have the plugs that can go in, right?
Yeah, oh good, yeah.
And what are those exactly?
Well, the punctal plugs allow us to just keep the tears that you have in your eyes and keeps them in the eyes. So they go into these very small, right in this corner here and corner here. There's actually ones on the superior part of the eyelid, but they block the drainage.
Okay.
Tears, yeah.
So the treatments can run from something very basic, just depending on the severity of it. And is it something that with proper treatment it can go away?
Dry eye is a chronic condition, so we can control symptoms, and we can do a really good job of it. I have had many patients who came in and very uncomfortable, and over time they're very, very comfortable, but once they stop, it comes right back.
Okay.
So yeah, it's not something that you can just wave our magic wand, which I wish we could.
Okay.
Yeah.
All right.
Yeah.
And as you said, sometimes not that people are going to get up and move where they live, but that could help at one point if they decide to, move off to a different place or anything else. That could actually benefit them.
Yeah, if you want to move to Hawaii or the Caribbean, you probably won't have too much trouble.
All right, very good.
Yeah.
Thank you very much for coming on today.
Yeah.
And again, if you feel like you have this condition, get your eyes checked, but you should be getting a vision test anyway.
Correct.
Am I right?
Yes, about once a year.
All right.
Yeah.
Doctor, thank you very much. Harvard Eye Associates is right over here nearby, and great folks that work over there. We always get wonderful doctors that come on, and the staff over there is fantastic
We're
too.
so fortunate.
Thank you
Yeah.
very much. Good to
Thank
see you again.
You too.
We'll be right back.